Medicine has solved most mysteries of human death. But some unexplained deaths occur inside hospitals, inside homes, documented by professionals and still defy every law of medical science. We trust doctors. We believe science has answers. But unexplained deaths continue to happen right in front of medical experts who cannot explain them. Here are 3 cases of unexplained deaths, so medically bizarre that physicians and pathologists still debate what actually killed these people. This is the mystery of Sudden Unexplained Nocturnal Death Syndrome. It began in Southeast Asia in the 1980s and continues to this day. It primarily affects young, healthy men during sleep. These men are athletic with no pre-existing conditions, and then, mysteriously, they die in their sleep. The medical community called it SUNS. Hundreds of cases have been documented and thousands of autopsies performed. And yet, no one could determine the cause of death. The body showed no signs of poison, no evidence of heart disease, and no brain abnormalities. Their organs were pristine, yet the heart simply ... stopped. Medical investigations revealed something profoundly disturbing. The victims reported experiencing nightmares, vivid, intense, terrifying nightmares immediately before dying. Some were found clutching their bedsheets. Others had expressions of absolute terror frozen on their faces. Neurologists examined brain patterns and found evidence of extreme fear activation, as if the victims had experienced psychological terror so intense that their hearts literally stopped. But here's what makes this scientifically horrifying. The fear response should be lethal in healthy young men. The human body is designed to survive terror. Yet in these cases, the fear killed them. Autopsies revealed electrical abnormalities in the heart tissue, but these abnormalities were never present before death. They appeared at the moment of death. Cardiologists were baffled. Psychiatrists were baffled. No medical explanation could account for healthy hearts suddenly developing fatal arrhythmias in response to nightmares. To this day, deaths from SUNS continue in Southeast Asia, with over 3,500 documented cases. Medicine still cannot explain why intense fear can stop a healthy heart. Some have theorized genetic factors or viral causes, but none of these theories can explain the psychological component, the universal presence of terror in the moments before death. What kills these men isn't a disease. It's something science hasn't learned how to classify yet. Next is the Unyanyan case. In Japan, 2008, a woman was admitted to the hospital with a simple complaint: persistent hiccups. This case would perplex the entire Japanese medical establishment. Her name was kept private, so doctors called her simply Patient U. She was otherwise healthy. The hiccups were annoying, but not life-threatening. Yet within days of admission, she began experiencing severe neurological symptoms: muscle spasms, loss of coordination, hallucinations. The medical team ran every test available: brain scans, blood work, spinal taps, toxicology screens. Everything came back normal. But Patient U continued to deteriorate. Her symptoms escalated from hiccups to total neurological collapse, and then she died. The autopsy was performed. Pathologists searched for anything: infection, tumor, poison, a genetic abnormality. They found nothing. The brain tissue showed no disease, no infection, no structural damage. The organs were completely healthy. Yet Patient U was dead, and the cause of death remained completely unknown. Medical journals documented the case extensively. Neurologists from around the world reviewed the evidence. Specialists in infectious disease, toxicology, and genetics all contributed theories. But none could account for the progression of symptoms in a brain and body showing no pathological evidence of disease. The most disturbing aspect: the symptoms suggested something was actively attacking her nervous system. The progression was too rapid, too targeted, too systematic to be random cellular degeneration. But what was attacking her? What could cause such specific neurological damage without leaving any trace? This case was eventually buried in medical archives, not because it was solved, but because it remained unsolvable. Medicine doesn't like acknowledging the boundaries of its knowledge. Some theorists suggest an unknown prion disease, a misfolded protein that destroys the brain without leaving evidence. Others propose an undiscovered virus. But the truth is, patient, you died from something that left no fingerprints, no evidence, no explanation. And that terrifies medical professionals far more than a disease they could name. Finally, the story of a young woman's descent into madness and death, a case that rewrote modern medical understanding, yet started as a complete mystery. She was 23 years old, brilliant, a promising young woman. And then, suddenly, her mind began to fragment. Paranoia, hallucinations, violence, catatonia. Within weeks, she had become unrecognizable, a person trapped in a body that no longer obeyed her consciousness. She was hospitalized. Psychiatrists believed she was experiencing acute psychosis and administered antipsychotic medications. She didn't respond. Her condition worsened. She became seizure-prone, and her body went into convulsions. Doctors sedated her deeply, and still she deteriorated. The psychiatric team was stumped. The neurologists were baffled. No clear diagnosis, no effective treatment. Just a young woman slowly dying inside a deteriorating mind. For months, she remained hospitalized, sedated, monitored, and slowly fading. And then, a single doctor, one physician who questioned the automatic psychiatric diagnosis, ordered a spinal tap looking for autoimmune markers. What they discovered changed everything. Her immune system was actively attacking her own brain. It wasn't a psychiatric disorder or a neurological disease. It was an autoimmune condition so rare, so new to medical science, that it had been misdiagnosed as mental illness. The condition was named NMDA receptor autoimmune encephalitis. But here's the truly horrifying part. Even with the diagnosis, the treatment options were limited. Her immune system had already destroyed significant portions of her brain tissue. Immensely powerful immunosuppressant drugs were required. And for a time, she did recover. Partially, miraculously. But the case revealed something even darker. Before this specific diagnosis was identified, thousands of patients with this condition died. They were diagnosed as psychotic, treated as mentally ill, and their immune systems destroyed their brains while doctors watched, unable to help. This single Kaiser disease, so new that it had no name, no diagnosis, no treatment protocol, represented the limitations of modern medicine starkly. How many similar conditions exist right now? How many people are dying from diseases we haven't even named yet? How many unexplained deaths occur in hospitals every day because we lack the framework to understand them? This case was eventually solved, but only by breaking the assumption that psychiatric symptoms mean psychiatric causes. How many patients remain hospitalized today, dying slowly because we haven't questioned our assumptions about their illness? Unexplained deaths remind us that medicine is not an exact science. It's a practice, constantly evolving, constantly discovering its own blind spots. For every disease medicine has conquered, there are others we haven't named. For every unexplained death we eventually solve, there are dozens we never will. These cases teach us humility. They teach us that the human body and the human mind contain mysteries that resist our attempts to categorize and control them. What medical case haunts you most? Have you experienced a medical mystery in your own life? Share your stories in the comments below. We are the Narrative Bloom, where medical mystery becomes human truth. Thanks for watching.